Hello, everyone. We'll get started. Thank you for joining us. My name is Karen Avasado. I know most of you, Division Manager for Athletic Services. We've got a great PowerPoint for you tonight and some great staff that are here to answer your questions and alleviate some of your concerns. And so before we get started, I want to introduce who we have here on the panel for you all. First, we have Chris Leonard, who's our Deputy Director, Deputy County Executive for Health and Human Services. We also have from the NCS staff, Lloyd Tucker, our Director of NCS, Sarah Allen, our Deputy Director of NCS, Keisha Dotson, NCS Division Director for Access Division, and Mark Martino, who is is with me under Operations Manager for Athletic Services. And then from the Health Department, we have Chris Revere, who is the Deputy Director of the Health Department. We have Sean Kiernan, who is the Section Chief for Communicable Disease Division of Epidemiology and Population Health. And we also have Barbara Downs, who is the Acute Communicable and Emerging Disease Program Manager. So with that, I'm going to hand it off to Sarah so she can go through some of the logistics of the meeting tonight. All right.
Everyone, Sarah Allen, NCS. It's great to see everyone. So I wanted to talk a little bit about our process this evening. First of all, this meeting or this session will go on for an hour and a half. So we have an hour and a half to work through the PowerPoint and your questions. The session will be recorded. We've already started recording. The Health Department will share a PowerPoint presentation and then answer any and all of your questions that you submitted ahead of time. As time allows, we're going to have, or the Health Department will take questions from you in the chat. My colleague Jason will be reviewing the chat and look for questions that haven't been asked and answered yet. And then we will ask them to the Health Department in order in which we received them. If a question, like I said, has already been asked and answered, we'll skip that question and go on to the next. If you are on the phone and you can't get to the chat, you may email us questions at ncsathleticservices@fairfaxcounty.gov, and we will have the Health Department answer those questions for you after the meeting. If we are not able to get to your question, they will be answered in writing, and the questions and answers, as well as the recording and the PowerPoint, will be posted on our Fairfax County NCS Athletics webpage. And then lastly, we're going to be muting people where possible, just to make sure that we can hear the presenter. So those are the housekeeping that's the housekeeping for this meeting. And with that, it's my pleasure to introduce Chris Leonard. And he and Chris Revere will be going through the purpose of the meeting. Chris, I turn it over to you.
Thank you, Sarah. Chris. Thanks, Sarah, and good evening, everyone. First, let me just say thank you to all the Health Department staff that are on. Certainly what you've been going through for the last year and 3 months or so, we can't imagine. Nobody imagined something like this would happen. And I know you've got a lot of work on your hands and basically a 24/7 operation. So I really thank you for your time tonight. Also, thank you to the NCS staff that are here, that are working to try to continue to provide opportunities for primarily, we're really focused in on the kids, but certainly we want the adults to be able to get out and participate in sports as well. And last, but certainly not least, I want to say good evening to all the volunteers that are represented on the call, and all the work that you're doing. I know it's very hard to run leagues, run teams, coach, etc., in the middle of a pandemic, but we really are glad that we're able to partner with you on making that happen. And to that extent, one of the things, and I won't be long, but one of the things I wanted to make sure that we're coming at this conversation tonight, from the perspective that back in July, we were one of the first jurisdictions that opened up our fields and allowed competition and games, etc., on our properties, and that's really continued from July I know there's a lot of jurisdictions that did not allow a winter season for basketball to get indoors and play, but we did that as well. And when I say we, I want to make sure I'm clear. It's not only NCS pushing this, but we were lockstep with the health department the whole time. We've known about the impacts, particularly to our youth, the mental health, well-being, being out of school. We've known about all those impacts since this started last March. And that's one of the reasons why we've been together in trying to make sure that we provide the opportunities for kids to have the outlet to be able to participate in sports. I'm from the sports world. A lot of our NCS colleagues are from the sports world. We certainly can tout all of the benefits. And we saw gradually how our kids were reacting in an isolationist environment when everything got shut down last March. So we were really happy that we were able to get sports up and running. But I definitely wanted to take a step back and just say that we've been doing this since last summer. Certainly, we know a lot more about the virus and mitigation strategies today than we did back in July. So we've learned from our fall season. We've learned from our winter season. We're going to learn more from our spring season. So as we continue to evolve practices, et cetera, it's important that we all continue to understand that we all have a spirit of wanting to get kids and adults back to some semblance of normalcy, understanding that we're still in a pandemic. We're still in a situation where we can't guarantee safety, but what we can do is do everything possible to provide the mitigation strategies that make it as safe as possible for all of us to be able to participate. So I just wanted to take a step back from that perspective and make sure that we all understand that we're all in this together. Nobody's trying to shut anybody down. We just want to try to provide the most safe environment as possible for all of our participants to be able to play sports. And I'm really grateful for the health department to be able to free up some time tonight to be able to come and answer questions. And I'm certain that this will not be the end of question and answer. We'll be able to continue to have this dialogue, but let's all just remember that we are all coming at it from a perspective that we understand the benefits of sports participation. And we're trying to do the best we can to be able to provide that safe environment. So I just wanted to say that really quickly, and I look forward to hearing the conversation tonight. And I'm sure all of our questions will be answered in due time. So thank you, Sarah, for your time. Chris?
Great, thank you, Chris. Appreciate that introduction and your wise words. Good evening, everyone. I'm Chris Revere. I'm the Deputy Director for Innovation and Planning at the Health Department. I'm very pleased to be with you tonight. And I'd like to just set the table for a moment about what we're going to discuss and why it's so important. So first, to state the obvious, we're all tired of hearing about COVID-19, and we want it to be over and done with. The problem is COVID-19 isn't done with us. The virus is still very much present in our community. We're seeing over 800 new cases each week. And as we know, if we let our guard down too soon, the number of positive cases will spike very quickly. So we have to keep this in mind throughout the season and remain vigilant. Second, and I want to emphasize this as Chris just did, your health department is not trying to intentionally or unintentionally shut down recreational sports for youth or adults. What we're trying to do in partnership with each of you is minimize the risk of infection and spread of the virus based on what we've learned throughout the pandemic and over the last 14 months. Minimizing infection risk and disease spread has been our prerogative since day one, and that hasn't changed. In fact, much of what you're going to hear tonight is not new, and it is consistent with CDC and Virginia Department of Health guidelines. But obviously, that's not how this information is being perceived in our community. So first, I want to sincerely apologize. It wasn't our intention to create confusion or anxiety with you about our process and our goals. and we can do better, and we will. Our job at the health department is to be clear and transparent with the public and with you, our partners. Now, thirdly, and this is some good news, if we follow health and safety protocols and vaccinate enough people in our community, and I encourage all of you to get your shots and encourage others to do the same, we will get closer to enjoying our lives more freely again. But I have to temper my optimism by saying that despite our best efforts, we can't control every aspect of what people do in their lives. Positive cases happen and will continue to happen among athletes, coaches, and their families. I want you to remember that no vaccine is 100% effective in preventing COVID-19 infection. And while some recreational sports are more or less risky than others, there's no such thing as zero risk of becoming infected, whether you're indoors or outdoors, on a playing field or on a court. And one of the most important tools that we use to protect our community from widespread virus transmission are case and contact investigations. These are routine and proven public health practices that existed long before the pandemic, and they are applied consistently and without malice toward no one. Effective case and contact investigations require three things: speed, trust, and cooperation. Speed is important because we are in a race against time with this virus. It spreads easily and quickly because it's new. And you may have heard that it is mutating, which can speed up transmission even more. Trust is important because we need you, your coaches, and parents to pick up the phone when the health department calls because of a confirmed positive case or potential close contact with that case. And the third aspect, and I think the most important, is cooperation. Everyone in this meeting tonight is a partner with us and with one another. We absolutely need everyone's cooperation, or the case and contact investigation process comes to a grinding halt. And as a result of not being able to contain the virus in our community, we're only going to be prolonging the pain of restrictions remaining in place and leaving open the possibility of even tighter restrictions if things really get out of hand. Case and contact investigations are serious business. And as we will learn tonight, there are roles and responsibilities for all of us. So the bottom line is this: we are much stronger fighting this pandemic together than apart. And as Chris just said, we want recreational sports played in the safest environment we can provide for everyone. We are all in this together. So I hope this helps frame our intentions and puts us on common ground. So at this time, I'm going to turn it over to Sean Kiernan, our Communicable Disease Section Chief. And Sean's going to take us through a slide deck that we hope answers many of your questions. And then we'll have some time following his presentation for some more Q&A at the end. Sean, you can take it away.
Thank you so much, Chris. That was a great introduction. Good evening, everyone. Thank you so much for joining us at this late hour during, I'm sure, a lot of your spring break. So thanks so much for joining us. As Chris said, I am Sean Kiernan. I am the Section Chief of Epidemiology at the Health Department. I'm the lead of the Communicable Disease folks. During the COVID response, I am currently the Deputy Operations Section Chief, which just is a fancy word of saying I'm in charge of a lot of the containment investigation side of things, as well as the epidemiological side of things. We absolutely, again, appreciate you coming on board. I've tried to answer most of the questions that you guys have provided beforehand. Please, if I miss a few, just type them into the chat or email into the group, and we'll make sure we answer all of your questions as we move through the slides. Okay, let me move the slide. Okay, great. Okay. Really wanted to provide some context for you all of why we thought this presentation was necessary and how we think it'll help moving forward in regards to kind of our partnership. over the past few months, we have seen a significant number of cases and outbreaks associated with youth athletics since about October. Now, I don't think this is truly surprising. I think sports participation, as you're aware, has also increased since that time. But I've been working in communicable disease at the health department for about 10 years now. We rarely see youth sports outbreaks. Mainly what we see is rash outbreaks amongst things like wrestlers, maybe 1 or 2 a year. And this is a significant number of outbreaks that we've seen amongst youth athletics. So the purpose of the documentation that we're trying to share with everyone is just to make sure that everyone knows our processes. And we want to be as transparent as possible so that we don't have individuals caught off guard when these investigations do occur. The majority of the information that we're sharing in that documentation is existing. We've been doing it for about a year and a few months now. We've done over 70,000 investigations at the health department. We have a team of about 400 individuals doing investigations for the Fairfax County Health Department. So we obviously have a lot of experience. So the purpose of this presentation tonight is to try to go through all of the points on that document to just clarify and answer the questions that we've received along the way. That document, and I do want to make note of it, the document that we shared with you, that's a process that we have in place right now. We obviously are open to changing our processes as more information comes, and I think I'll touch on that in a little bit as well. I do want to reiterate that the health department 100% recognizes and promotes the physical and mental health benefits of recreational sports. I mean, obviously, exercise, peer competition, socialization, these are all great things. And our goal is to ensure the safest environment possible for all athletes, coaches, families in our community. And that needs to include timely and thorough case and contact investigations. That is one of the major tools in our toolkit in stopping COVID transmission throughout our health district. It is something, it's the bread and butter of the health department, so to speak. And we really feel it is extremely important and needed in this setting. As I said before, our processes, we are obviously willing to update our processes based on best practices, updated recommendations from the Centers for Disease Control or the Virginia Department of Health, and our local disease activity levels as well. I think that's another thing that's kind of lost here. Chris mentioned it a little bit. We're not out of the woods yet. We all feel like we should be out of the woods and we want to be out of the woods, but unfortunately, we are not out of the woods yet. You can see from our current case counts, and I did want to share this with you, we've seen 2 peaks so far in the Fairfax Health District. We saw our initial peak in late spring, early summer of last year, 2020. Then our activity levels were very low over the summer and the fall of 2020. Then we had our very significant increase in the winter months of this year. Currently, our 7-day average is unfortunately slowly increasing after a sharp decline from that peak. We're at about a case average of 170 cases a day, which is higher than we were all summer and all fall last year when everyone was taking COVID extremely seriously and all mitigation measures were put in place very strongly. So we got a lot of comments and questions about why is this coming out now? COVID is done. And I just really want to express to you that we are by no means out of the woods, especially given that we're seeing more and more variants circulating in the Fairfax Health District. We hope that vaccination will get us through to the clear. I don't want to get too technical here. These are some modeling projections from the UVA on where they think we're going to be this summer. So the end of the graph by time-wise of the 3 graphs is this summer. What they're predicting is if we keep on doing a great job with all of our mitigation measures and the variants don't change much, guess what? The figure on the far left shows our disease activity plummets this summer, and we get closer and closer to normal. The middle graph shows that with new variants and our current mitigation, we still see a pretty good decline in cases. So the dark blue line is the average of what they expect to see. The one that we really need to avoid and why we stress all of our mitigation measures is if the far right, where we could see a peak just as high as we saw this winter the world would return back to a pretty dark COVID-filled place, and we don't want to get there. So really, this is not, unfortunately, the time to relax. We are getting a little bit more of our freedoms in sports back, which is great. We absolutely appreciate it. But what we do need to do is we do need to keep strong on our mitigation measures, including case and contact investigation, to ensure that the far left figure is where we are, not the far right figure. And I know we all agree with that. The increase that I did mention before, since October 1st, we have seen 24 outbreaks in youth athletic groups. And we've seen 125 cases. The average number of cases per outbreak has been 5. So most of our outbreaks are pretty much, when we see cases, we're seeing pretty fairly significant outbreaks with those cases. That's not what we want to see. We want to see no transmission, but this is the purpose of case and contact investigation. We have an average number of contacts of about 15 per investigation. And the thing that's really, really shocking to me, youth athletics makes up about 7% of all of the outbreaks of COVID-19 in the Fairfax Health District. Like I said before, I've been working for the Fairfax County Health Department for 10 years. We rarely see youth outbreaks, youth sports related outbreaks. And for 7% of all of our outbreaks during the course of the pandemic to be related to youth sports, that really spoke something to us. And that really expressed our desire to get information out to you guys, to make sure you're aware of how we are approaching case and contact investigations. As you see below, we have outbreaks in a myriad of sports. Some sports that are able to social distance better than others, some sports that practice and play indoors versus outdoors. We've seen kind of the gamut on that. So though obviously outdoor activity is much safer from a risk perspective, we have seen outbreaks obviously related to outdoor activities and outdoor sports as well. I think you guys are aware of this, but why are we really emphasizing on youth sports? Well, we're not singling out youth sports. We are singling out a higher risk activity that's currently ongoing in Fairfax County. So I'm sure you've heard similar news stories about eating in restaurants. Eating in restaurants is higher risk because individuals have to take off their face coverings while they're eating, increasing the possibility of risk of transmission, especially in an indoor restaurant. So it's a risk decision. When it comes to youth athletics, really the thing that's increasing risk is twofold. Number one, a lot of sports, you can't socially distance during those sports. The nature of the competition states that we can't maintain social distance during a soccer game. It's just not possible. But, people are going to be close to each other. The other thing is individuals, when they are playing sports, are going to breathe heavier, hence increasing the risk of transmission. COVID is primarily spread from one person to another through respiratory droplets. Respiratory droplet dispersion occurs much more when you are breathing heavier. And I think that obviously commonly makes sense with everyone. Everyone kind of understands that premise. So that's why sports are just going to fall naturally into a higher risk category. As I said before, indoor settings are a little bit higher risk solely because the respiratory droplets are not dispersed as widely as you might see in outdoor sports. Unfortunately from us, the CDC and the Virginia Department of Health classifies them the same exact in regards to our contact investigations. We do not treat them any differently. I guess what we like about outdoor sports though is it is less risky, and we absolutely will say that they are less risky option. Unfortunately, when we're doing case and contact investigations, it won't change the fact if it's an indoor and outdoor sports, because that's what public health, our public health leaders are telling us that's how we should be approaching it. So kind of our approach so far to COVID in youth athletics, and obviously this applies also to really any recreational sports. We're focusing a lot on youth athletics because they're the primary users of a lot of the fields. But this also applies to adult athletics as well. All of these recommendations would be similar for them. Because of that higher risk activity, they pose a risk for COVID transmission, of course. Back to kind of the youth side of things, we absolutely prioritize in-person learning. We've worked with the Fairfax County school system to implement the exact same policy. They started it about a month ago, the exact same policy. You might have seen on the news that already a football team has been told to not practice for 14 days and compete for 14 days because of an outbreak. They have been very, very satisfied with how this has worked and how our on-contact investigations have occurred. But you know, what FCPS realized was, if we're seeing, they wanted to stop that transmission as soon as possible on that sports team, because they didn't want it to have an effect on more individuals being quarantined and not being able to go back to in-person learning. So that's where our prioritization for in-person learning would apply to any youth sports team. We want to stop the transmission as much as possible. That is the goal of the health department. So we want to make sure that when we have transmission, maybe only one more person gets sick, not an entire team, so that an entire team needs to be quarantined and doesn't miss school. That would be our goal there as well. We've been really pushing for a pause in activities while we do our investigation. So we are recommending that all team activities are paused while we do our investigation. And that makes sense from your perspective as well. I know you guys don't want to have kids practicing who could possibly be infectious or should be quarantined with disease. Our investigations are fairly timely right now. We do them in about a day. You know, on the documentation, it says 24 to 72 hours just to make sure. But for the most part, we can get to investigations within a day. So we hope that pause isn't long, but that pause is really for your benefit, to ensure that we are telling everyone who needs public health guidance and instructions those guidance before they practice or compete again. I know the last thing you guys want is, you guys want to keep it to one team. You don't want it for that team to compete against another team, transmission to continue, and then you have 2 teams in your league and then 3 teams. So that's really the reason for the initial pause while we do the investigation. Another bullet I just want to make perfectly clear for you guys: it is the health department's legal role and responsibility to determine who needs quarantine from possible exposures. Another way of saying that is, we are the sole and only authority who has the legal authority to do contact and case investigations in Fairfax County. That is our role. I don't think your teams want to get involved in this process. You absolutely don't. Plus, we're giving very, very strict guidance that can only be given from the health department. It can't be given from a coach or a league to players in regards to isolation and quarantine of individuals. We are fully responsible for that. So we thank you for your willingness to try to help us with these investigations, but I think the thing is, it is our responsibility to do those investigations. So we absolutely want your help. We want information from you, but it is our job to determine who should be quarantined and isolated in the event of a case. And then, just in some circumstances, I'm sure you're aware, because it's happened for some of your teams, the team may need to stop activities for 14 days. That's really because of twofold. Number one, it just might be that most of the team is quarantined and it doesn't make sense to have team activities for 14 days. You can't play if you only have 3 members of your basketball team available, of course. And then the other side of it is, you might stop because the health department is recommending that you stop because you have an outbreak on your team. So really, that's going to be happening for outbreak or quarantine situations with lots of cases. Okay. We got this question a lot. I wanted to make sure that you guys were aware of this. What are you actually required to report to the health department? What are you legally required? So the Virginia Code kind of lays all of this out. And it requires that outbreaks are reported by sports leagues, which fall under the entities of day programs, to the health department. So outbreaks are 2 or more cases. You are legally mandated to report that to the health department. We have also requested, and we strongly urge you to report individual cases of all reportable diseases to us, specifically, obviously, in this scenario, COVID-19. We want them reported to the health department as well. Now, how we generally find out about cases, just so you're all aware, is if you go to the doctor, you're going to get tested for a disease. The lab results of that individual come to the health department. So, you know, if you do not report an individual case to us, we will find out about it solely because the doctor is going to report it to us. We are urging you to report it to us as soon as possible, solely because that will speed up our investigation and get us through the investigation quicker and more efficiently. We can act on that sooner. We can get individuals out of practice and out of competition as quickly as possible, and then they're able to return quicker as well. So that's really the reasoning behind that. But you are legally required to report 2 cases. We are strongly urging you to report 1 case to us. Where do you report those cases to? We currently have an online survey. We're going to share this PDF with you guys. But this is the reporting link for you to report it to us. It is a secure link. Obviously, the health department deals with sensitive information all of the time. We receive confidential information all the time from various entities regarding case and contact investigation. And we just urge you that you please include all of the information when you're submitting the form. We've had lots of leagues and coaches say, boy, the health department calls us a lot. And that's because we're just trying to round up all of the information that we need to get the investigation complete and done as soon as possible. So just, again, strongly urge you to put as much information as possible, including team rosters and contact information in there, or to speed up our investigation, and so that you guys don't have to be badgered with more calls from us regarding, hey, we need phone numbers now from this group. A lot of questions came in and, well, can I even share that information? And, you know, we can't share information on our youths. It's, you know, we're not allowed to. And I do have to say, we've looked this up numerous times. We had our county attorney look at this, and the Virginia Attorney General looked at this as well. There is no reports and disclosures of the health department are immune from any civil liability or criminal penalty. You're actually more, you need to work with us. Kind of the last bullets there. You know, we're asking for a voluntary complying of contact information, or if we don't get that, we can get an order for compliance, and a misdemeanor could be attached to that if we're not getting the information we need in regards to a case and a contact investigation. So I do want to say, obviously, all of the information we receive is kept strictly confidential. You have no legal right to not share information with me. With us, it's actually the other way around. You're more required to share all information that we're requesting that is pertinent to the case and contact investigation. We are not trying to collect information that we don't need. You know, we need names and phone numbers. Really, that's what we need from you guys. That is the information that we're trying to collect, so we can do our case and contact investigation quicker and more efficiently. There's always a little bit of confusion, so I wanted to kind of lay out the 2 different types of actions that we're talking about here. Quarantine, a lot of times, is getting confused with the pausing or the stopping of the activities. So a quarantine of an individual is an individual public health order. It is not voluntary. This is when you are exposed to a COVID case. This is the not the recommendation. It is the order that you stay home and away from others for 14 days. Unless you do develop symptoms, then we want to test you, and then you're going to be isolated. Isolation is for cases. Quarantine is for contacts. This is individuals cannot go to school. They can't leave the house. If you're a coach, you can't work. You have to stay at home and away from others for 14 days. Again, that is an individual order that is given by the health department. That is the purpose of case and contact investigations, to give that order to the individual who is deemed a contact to a case. The pausing or the stopping of your activities is a public health recommendation that, again, we are strongly urging. I do have the kind of the clause there, though, that can become an order. So if we had an outbreak that really, really escalated from a case perspective, we can make that an order if we need to. We want to avoid that as much as possible. The reason for the pausing, as I said before, is to allow us to complete our investigation and to further limit exposures on teams and any other teams. Like I said before, you want to limit that case to 1 team. You don't want another case even on the team, of course. But the reality of the situation is, with the amount of disease we're seeing in Fairfax County, I think for most of you, dealing with COVID is not an if, it's more of a when. I think most of you will see a case amongst your teams. And I think the reason that we want to pause that sport while we're doing investigation is you want it to stay at one case. You don't want it to get to another team. You don't want to get it to throughout the team as well. So please pause for your own liability sake. Please follow our recommendation to pause it. The pause when we have an outbreak, and I'll show you on the table that is given to you. Again, that's a public health recommendation. Most of you are doing that already. When you have an outbreak on a team, you completely agree and understand we should not have this team play for 14 days from the last date of exposure. That is to limit the spread of disease amongst that team and in throughout your league. That is the purpose for it. So again, quarantine is a legal order. It needs to be followed. We are strongly urging you to follow the public health recommendations and it's for your own good to stop the spread of disease amongst your teams. So our exposure definition, again, this is something that has been the same since the beginning of the pandemic. I think a lot of people really understood they heard hey, I know, 6 feet, 15 minutes. I've heard that 1,000 times. So that's what people really, really stuck with, which is great. That is 99% of the time, that is what we are using for control measures and for how we're determining if someone is a contact to a COVID case. Now that is cumulative time. So that is over a 24-hour period. So, this is where it's getting tricky, right? Because a basketball game, how much contact is that when I'm right next to someone? I think a lesser known sub-bullet, which is the one that is in the red below it, having direct exposure to respiratory secretions from a person who has COVID-19. We primarily use this one only in the sports setting, household contacts a lot of times as well. But this is the sports setting one, right? This is a sport like, let's say, wrestling, where there is direct and intense physical contact. We've had arguments in the past with coaches and players who said, no, I actually was only exposed for 4 minutes, so I'm not a contact. This is where we would argue and we would use our expertise to say, no, that exposure, that direct and intense physical contact related exposure, we would consider you a contact because you wrestled with a COVID positive individual. We are not using that though in all sports. A sport like, let's say, baseball, it would never be used. We don't have physical intense contact. So I think that threw off a lot of individuals when they saw the documentation. This is for sports with a lot of physical contact. It's hard to break down all the sports because, really each setting and each team is unique. This is where I think basketball on a basketball court would be thought about the same way. If I'm playing basketball against someone, that is direct and intense physical contact where they're actually talking, they're actually touching each other a lot. They're sweating on each other a lot. That's where the time means less for us. And that direct exposure means a lot more. And I think that makes sense to a lot of people, more so with the direct, that intense physical contact component. And then obviously the two other things, providing care for a person and living with a person who has COVID-19, they are always obviously as well considered part of our exposure definition. So what we do is when we find out someone is a COVID-19 case, we determine everyone who meets those 4 bullets while the person was infectious. And everyone who meets those bullets is then quarantined. That's how a case and contact investigation goes. Every situation is unique. And we really we don't want to put the undue burden of quarantine on individuals if we don't need to. We are not out there trying to quarantine folks who don't need to be quarantined. We are trying to do, with the information that is provided with us, the safest and best thing for our community in every circumstance. Another question that comes into us a lot is, why is the quarantine guidance 14 days long? I know CDC, and I saw on the news that CDC said there's a shortened option for quarantine guidance. And if you look at that guidance on the CDC website, the first sentence of it is 14 days is the preferred method of quarantine, and local health departments have the responsibility for determining what is the quarantine length in their district. In the Fairfax Health District, we looked at the risk associated with shortening quarantine. We do not believe it's worth the 4 days extra that you get out of quarantine. So in the Fairfax Health District, just like throughout the rest of the Commonwealth of Virginia, we do a 14-day quarantine. That is ours. The figure on the right is showing you the risk that, if you're letting people out of quarantine early, you could see as high as a 5% risk of transmission from individuals who we believe should be quarantined. So that's kind of where we based our judgment there. The table that tried to lay out pretty much everything for you all in regards to how we're approaching team guidance, quarantine guidance for when we have cases on your team. Again, it's really hard to throw blanket statements in there because we know every situation is unique. We tried to split this up based on if you can always maintain social distance versus if you can't maintain social distance. So a classic example of a sport on the bottom category would be golf. So in golf, you can always maintain social distance. So a golf team, we will treat slightly differently. The table, as you can see, there's not much of a difference between the two. The only difference really comes about when we get into the last column, which is the guidance related to when you have a competition, a game, against someone else. So when we have a case on a team, we are strongly urging you to pause the team, all practices, competitions for the team while we do the investigation. Again, that is a short period of time, hopefully about a day. We will get back to you and say our investigation is done. You can resume activities. When there is a single case of COVID-19 on a team, whether they can maintain social distance or not, we are always going to do a contact investigation, of course, and we only quarantine based on if an individual meets the exposure definition. We are not blanketly ever saying an entire team is quarantined. We will do a contact investigation always and quarantine based on that contact investigation. When there are 2 cases on a team, so that's an outbreak. An outbreak, that is escalating our actions, our public health actions, because that would show that there's evidence of transmission on that team. That's where we are strongly urging you to cancel all team activities for 14 days from the last day of exposure. We, again, only though quarantine individuals who, based on our contact investigation. So if you have an outbreak on a football team with 60 individuals and we only quarantine the wide receivers and the offensive linemen, the rest of the team can't practice. We are strongly urging them not to practice, but what they can do is they can go to school, they can still do things. What we're trying to do there, and you might say, well, that doesn't make any sense. What we're trying to do there is taking away the high risk activity that could further propagate the spread of disease in that setting. So that's what we're trying to do. We're starting the lower risk activity of going to school socially distanced really is not much of a concern for us. We're trying to get rid of the higher risk activity. And I hope that makes sense. Again, no difference really between sports with unable to maintain social distance and those who are, other than the competition guidance. So when you play against someone, we would always recommend, if you can't maintain social distance during that game, that notification is made to the opposite team. And again, we may have to quarantine individuals based on the setting of the sport and the competition itself. Certain sports we're going to quarantine more than others. I can't make, again, blanket statements, but just thinking about it as baseball, there's not a lot of interaction. It'd be pretty unlikely for us to find, to have to quarantine individuals on the other team in regards to COVID-19. But if we have a sport like basketball, where there's a lot of direct physical contact, we may have to quarantine individuals. So I hope you see the difference there. There is no one size fits all for these investigations. We are, again, really trying to quarantine only those individuals that we feel should be quarantined. A question that commonly came up to us as well, when we have difference in types of athletic activities, why would the guidance be the same? And again, we recognize that each sport has features that make it more or less risky for spreading COVID-19. The indoor versus the outdoor, close contact versus more distance players, for more distance between players. But without doing that investigation, we might find some unique aspects of a team's practice that would make us say, hey, that activity we shouldn't be doing because they didn't maintain social distance. And that's going to mean we're going to have a lot more contacts. So it is very, very much individualized. Again, I do want to emphasize risk outdoor versus indoor. We know that there's less risk outdoor versus indoor. I kind of put this along the same lines as wearing a cloth face covering, right? So everyone knows that's a great way to stop the spread of disease. You wear a cloth face covering, you are protecting yourself and you're protecting others, which is great. Just because you wear a cloth face covering, though, if you're exposed to someone with COVID, if you work right next to someone with COVID and you both wear a cloth face covering, we're going to still consider you exposed to that person because you're within 6 feet for 15 minutes. Your risk of getting disease is much lower, which is great. But we're still public health. Our end game is to stop transmission in the community. We need to take the more conservative approach so that individuals are quarantined out of the public, so that individuals are not spreading the disease more. I should have said this in the preamble to all of my talks. We really appreciated the opportunity to work with NCS and the Parks Authority on this. We are continually working with them. We continually meet with them. We have a monthly meeting now where we're talking about youth sports and any changes to the guidance so that you all can be appraised of the situation as well. Our goal, again, is to provide a safe environment for all of our players and coaches. And we want to make sure that the COVID-19 protocols are followed by all participants. We also work very closely with the Virginia Department of Health. We have run this guidance by them numerous times. They fully support this guidance, and they're actually looking to implement it statewide because this is somewhat of a gray area in regards to the public health. How we approach all these sports is very, very individualized, and we want to make sure we're being consistent across the Commonwealth as well. Fairfax County Public Schools and Falls Church City Public Schools and private schools, we are coordinating with them as well. What we don't want to do is we don't want to have our guidance implemented in one area and not implemented in others. So if I play on my high school basketball team, but my AAU team or my rec team doesn't follow the same guidance, that doesn't make sense, right? Our goal is to stop transmission in our community. So we're trying to do this coordinated across all the different sectors of youth sports and recreational sports so that we are all consistent. As I said before, Fairfax County Schools and Falls Church City Schools have implemented all of our practices about a month ago to very successful ends. They really appreciated our partnership with them. I'm speaking for them right now, but they appreciated our partnership with them, and it is honestly going very well. And having all this up front and everyone understand it up front is crucial here, right? Like I said before, we don't want people to be thrown off guard when they say, hey, we need a list. And this is our processes. We want to make sure everyone is aware beforehand of how we are approaching this so that individuals won't be surprised or not understand kind of our reasoning for these things. Did want to point out, I think in Fairfax, we are doing a very good job in regards to athletic restrictions. So DC, the moderate and high contact sports, they can't compete. Montgomery County couldn't compete for a while. They just opened it up to competition I think last week, but a protocol plan needed to be approved for each team. PG County also allows low and medium risk sports to play and compete. High risk sports are prohibited. In our colleagues in the central region, they quarantine individuals, entire teams after a single case. So they are quarantining individuals. They're not just stopping the practice. Everyone on the team is being quarantined automatically when there's a case. We don't want to do that in Fairfax. We want to trust our case and contact investigation to ensure that we're quarantining the appropriate individual. And then other districts in Northern Virginia have very, very similar processes. Their exact processes vary, but we're all playing by the same rule book. We want to be as consistent as possible across the region as much as we can. One thing that we never talked about, which is the stuff that you guys I know are doing a great job of already. Case and contact investigation might be foreign to a lot of you. You might not have heard of it beforehand. So that might have been new material for you all. What you are doing a great job of is getting these athletics out there safely as possible. So I know you guys are all aware of these. But this is the guidance that you guys have been probably reviewing and making sure of at every practice and game is happening all the time right now. So I just want to say, keep up the good work. It is absolutely essential that we do these things on this slide This is the keeping up the vigilance, right? We don't want to make further restrictions in Fairfax County. We want to keep on opening things up and allowing for more freedoms and to go back to the normal world. This is how we do it, by making sure our youth athletics are as safe as possible. I do have some additional resources for you. Again, you guys are going to receive these slides, so you'll be able to click on and look where kind of all of our references come from in regards to where we're citing these things. Obviously, we are completely science-based. We follow CDC and Virginia Department of Health guidance pretty much that is how we follow. That's how we develop all of our guidance. And then I am all done. Obviously we have some time now for questions, so I will kick it over to our moderators to answer some questions, or to give me some questions.
Great, thank you, Sean. That was great. I really appreciate it. So what we're going to do now, as we mentioned, people have been adding questions in the chat. I do realize, though, it wasn't real time, so some questions were related to a slide that might have been up on the screen. So Jason's going to do the best he can with going from the beginning of our session and going through questions and asking them to our health department colleagues. So Jason, if you're ready, go ahead.
Yep, I'm ready. Can you guys hear me?
Yes.
All right. First one is how is the health department notified / called to investigate and provide guidance? How are investigation results shared with the team and league? There were several kind of those. How is the league notified instead of just the individual teams?
Yeah. So again, the question, I was looking through the chat as well to see if I could read that kind of the questions themselves. So obviously all of our investigations are confidential. We have to protect the individual during these investigations. We share things back with you that our investigation is complete. We don't share back with you all this is how many contacts we found, this is how many cases we found. None of that stuff can be shared with you because it's protected information. You know, that's kind of how these processes work. What we can provide you for is an update on how many outbreaks we're seeing in our community. So the numbers that we provided, we can give you guys general sense of where we're seeing activity, but we can never identify leagues or teams or things like that. In regards to, you know, if we feel you should be notifying other teams who competed against it, we 100% will make sure you're aware of who to notify and notify you of that. So if the red team played the blue team and there was an infectious individual on it, we would obviously let you know, hey, would you mind notifying the blue team that there was a COVID-19 case that they competed against, you know, at that game. So that's kind of our typical public health investigation.
All right. Next one, for the 24 outbreaks, what sports were they associated with? It was a vast majority or a variety of them.
Yeah. So I can jump back to the slides. So we've seen it amongst these teams. These are the teams that we pulled out. So that's the basketball, dance, football, gymnastics, hockey, martial arts, and wrestling. So that's the ones. Obviously, we see a lot of indoor sports because that's what we just had, right? We just had winter season where we had a lot of indoor sports. We're starting to see more cases amongst a lot of different teams. Obviously, we're going to see cases amongst teams. It's going to happen, unfortunately. We're starting to see it amongst field hockey teams, soccer teams, all the different teams. We're starting to see cases. But outbreaks so far, that's the only teams that we've seen outbreaks amongst so far.
Okay. And there was a separate question. Was there any outbreaks for baseball at all?
No outbreaks so far for baseball, thankfully, which is good. I mean, it's good for everyone. We don't want any outbreaks, of course, but none so far.
Okay. Does all the everything reviewed includes adults, not just youth athletics, correct?
Yeah. So the guidance, I'm so sorry for the adult rec leagues that have been on and rec league participants and coaches. This would all apply the same. It's the same thing. We want you to pause your sports. You know, try to make sure you have good contact information for your teammates, things like that. You know, the coach has everyone's name and phone number, so you're able to share it with us readily when we do ask for it. So, you know, that softball team, you know, you can think of all the other, obviously the sports as well. And then I know it's really hard. And I didn't mention this, you know, especially it applies for both, obviously, for the adults and the youth sports. The get-togethers after are obviously just as risky as the activity themselves. So the dinner and the pizza parties and the going out for drinks after the game for the adult leagues, that's obviously a very risky behavior that could further extrapolate spread, and you might have more people quarantined because of those actions.
And this might be an NCS question. Did youth basketball has been allowed back in gyms? Is there when adults might be allowed back in?
Aaron should be on to answer that.
Sorry, I forgot how to unmute. Yeah, adults, we are at the hands of the FCPS on that. And the one reason why we were not allowed to have adults in is because they had to do a deep cleaning after our youth. So didn't have the time or the availability of space for the adults to come in after them. They cut off our time at 9, and usually adults went from 9 to 10:15. So we're going to continue to work with the school system to see where we are with that, and continue to push to get our adults back into gyms.
Okay. If an investigation finds quarantining is not necessary, who do they notify?
Yeah, so we would let the team know the investigation is complete, and that's it. You know, the individual knows that they have to be quarantined, so they can't practice if they were quarantined. But if no one's quarantined, then we're going to say investigation is complete. You can resume playing and doing activities.
And then if an entire team is tested and all receive negative results, do they still have to quarantine for 14 days?
Yeah, and this is where the CDC offered the test out strategy. They said it was an option for certain populations. In Fairfax, we do not allow that test out option for quarantine. The same amount of risk applies on my slide. So we do not think that risk is appropriate, especially for the setting of athletics, that we would have potentially infectious individuals who would be returning to spread the disease.
And then there's a couple of questions on clarification for the mandated kind of reporting. If one positive, you have to report it, and then if it's more than one, it's urged to.
Yeah. So let me jump to the slide on that one.
Okay,
that's a good one. Okay. So a lot of questions came. What do I need to report? And what is recommended and what is needed.
Right.
It is required by the Code of Virginia that outbreaks are reported by sports leagues. The who is reporting is gray. It's a coach. It's a league. It's you guys have to decide. The leagues have to decide who is responsible for reporting at the health department. But as an entity, the league is responsible for. So, say a soccer league. A soccer league would be responsible for reporting to us. If they say the coach can report it, then the coach can report it. It's up to you guys to decide who has to report it. Outbreaks, 2 or more cases are required to be reported to us. That's 2 or more cases on a team or a geographical cluster. So I don't want to get too much in the weeds on it. I'll send some more clarifying on it. But virtually, really what you're looking for is if there's 2 or more cases on one team within a 14-day period, then you guys are required by law to report it to the health department. Again, we provided the reporting link on the next slide, I think, that you guys will have.
That was actually the next question.
We strongly urge you to report 1 case to us. 1 case is going to be reported to us, and the reasons for that is we can start that timely investigation as soon as possible. We can get the investigation completed as quickly as possible. So that would be the reasoning for that. If you guys are already talking with us, and we know about cases. So every time you have an outbreak, you have an additional case, you need to report that to us as well. That would need to be reported to us as soon as possible as well. Where you report it, I'll jump to the next slide for you guys. It's this link. We have a HIPAA secure compliant link that you guys can report the case information and all the team information as well. If you guys submit the team information to us one time, you don't need to keep on submitting it every time.
Can you explain how you can justify applying the same risk mitigation strategy across the board for all sports that have different transmission risk levels, just because someone on a team or the opposing team is positive?
Yeah, I'm just reading it as well.
Okay.
Yeah. Sorry, give me a sec, guys. So it's the exposure definition is always the same, right? It's malleable to the setting that we're in. And I'm just going to go to, I'm just going to go to the slide. So when we're talking about who we consider exposed and who we're going to quarantine, it's malleable to the sport. So it's not consistent across all sports. So a sport like golf, there's a good chance we would never quarantine anyone if they're socially distancing the entire time. So we are malleable. We do adjust to the scenario and the support and the sport that we're dealing with there. So a sport like, I use basketball a lot as well. Basketball, there's going to be a lot of direct interaction, especially during scrimmages. So we're going to have more contacts there. So we are being malleable and we are adjusting to the type of sport we're not throwing a one blanket statement over there for all of the sports. We are adjusting our approach of who is being exposed based on the type of sport.
And there's a question on the quarantine recommendation from the CDC, had gone to 10 days.
Yeah, the CDC, and I'll say it again because we get this question a ton. And believe me, you guys are not the only ones who are answering this question. We've got this question a ton from our FCPS colleagues as well about kids in school. Right on that first sentence there, it says 14 is the recommended quarantine period. These are additional options that can be entertained by a local health department. We are not considering those options. We are doing a 14-day quarantine.
Then there's a vaccine question. Sports officials or referees are independent contractors assigned to K through 12 schools to officiate students and players. Does that make them eligible for phase 1B vaccinations?
I don't know. I hate to put, Chris, would you know the answer to that one? I don't know the answer to that. I have a follow-up, but I'll see if Chris has the answer to that. Sorry, Chris, put you on the spot.
No, it's a great question. I don't have the direct answer either. I know we've had that question come up amongst volunteers and and people who tutor and things like that, but that's the first time a question about referees come up. But we can get an answer.
We'll get an answer to that. I mean, I think the good news is, and this is our vaccine supply, as you might have if you've been following the news. The vaccination is obviously another huge component of the health department response to COVID, making sure we're getting vaccine and kind of following along the different phases. Vaccination in about, I'd say a month, hopefully about a month, we will have open registration for all adults in Fairfax Health District. There's no promises there, but that's where we're tending to look like right now, that we are going to be there in about a month. So, and that's Chris was saying in the beginning, that is one way that we really can move towards back to normal. And, if especially the adult leagues, I mean, I didn't mention it here. If you're fully vaccinated within 2 weeks of your vaccine, this quarantine stuff doesn't apply to you. You don't need to be quarantined. You're not going to be quarantined. So that's really what we want. We want individuals vaccinated. Of course, for youth sports, those less than 16 years of age, they won't be vaccinated probably until the fall. So that's obviously unfortunate, and this will still be in their world for the summer at least. But at least for the adults and the coaches and the family members, we can do a lot of protection with just the vaccine and the vaccination effort. And like I said, that should be open in about a month.
There's a question to just describe a contact investigation.
Yeah, of course. So and I'm going to put, we have our contact investigation folks on the line. Let's see. Barbara Downs, would you mind describing the process for a contact investigation, or someone from your team? I'm so sorry, Barbara, to put you on the spot. Let's see if she's here and joining. She might be looking for an unmute. I guess I'll have to describe it. That's okay. I'll describe it. So the process starts. So we get a report of a case of disease. Generally that's going to be from a healthcare provider, a lab result, or it might be from you guys because you guys are reporting to us. So we find out about it. The first step we want to do is make sure everything looks legitimate. We don't want to start an investigation of an individual who doesn't have COVID. So we make sure that the lab results meet all the criteria that they would need to meet for us. Clinically, with people not showing symptoms, that doesn't matter as much anymore. Pretty much a positive COVID lab result is going to be what's going to really drive us with our investigation. So once we have that lab result, or sometimes it's a clinical picture, we would do our investigation. So the first stop is we're always going to contact the case or the case's guardian to figure out, when they develop their symptoms. We want to find out when their infectious period is. So then we're going to tell the case they need to be isolated, which means they need to stay away from others for 10 days. So if you're a case, you're out for 10 days from your symptom onset. So that's the case guidance. That's the 10 days right there. Isolation order is exactly like a quarantine order, except it's for an individual with disease rather than someone who's exposed. Then we try to ascertain contacts by talking to individuals. So if it's in a school, we talk to the teacher. We hide the identity. So, what we're doing is, in a classroom setting, we're talking to the teacher and saying, hey, we have a case of COVID amongst your class. Can you describe the activities in your class? We just are trying to get a good sense of what's going on. For sports, we do the same thing with coaches. Can you describe a practice for us? What's the amount of interactions? A lot of times, to be honest, you guys know who the cases already. We will not confirm it. We're just going to say, hey, okay, that's great. If you know who it is, we can't confirm that because, again, we're trying to protect medical confidentiality there. But we will work the process through, ask about activities. We will ask individuals if we can, so if they're too young, it's really hard to try to ascertain, were you close to Jimmy or Susie, anything like that. But if they're old enough, we try to get their sense of practices as well. And with that kind of combined information from the case, from the coach, from the other players, we put together a picture of who we deem should be considered exposed and then considered quarantined. So that's how the process works.
All right. Next one, how does contact tracing take place when considering a sporting event? For example, soccer, lacrosse, or field hockey. What is the assumption that a contact tracer will make about close contact in that activity?
So they won't make any assumptions. They will do their contact investigation like I described. So we'll ask about, what were the activities that happened? Did you guys play in a game? It's trying to develop a well-rounded picture to make the best decision possible for who should be determined quarantined. So we know some assumptions though related to sports, right? So if there was two goalies, we're never gonna. If you have one goalie who is a case, the amount we can make assumptions based on the sport that it's fairly unlikely that there's going to be a lot of contact against competing teams. Now the practices, there might be a lot of contact because of the drills they do and the way they practice and all that kind of stuff. But so we make up some assumptions based on the nature of the sports related to the competition, who you're competing against. But within practice, we need to obviously get a big picture of the practice to see how we would determine if someone is if we consider them exposed or not.
Next one, how long after a positive test is it safe for a player to return to sports activity?
So it's 10 days. So it's 10 days from either symptom onset or the lab test result.
And does the health screening have to be done the day of practice or a game, or can it be done 24 to 36 hours in advance?
So we want to recommend, so I'm not as familiar with this. I'm answering just from a kind of my general knowledge of screenings. We want it as close as possible to the actual practice event, given that someone could develop the disease since that time period, and you screening missed them. So as close as possible.
Not sure if this is NCS, but has youth wrestling been approved for return to FCPS facilities in Fairfax County?
Well, I don't know the answer to that. I mean, there's wrestling teams in, I don't know if there's, so I know amongst Fairfax County sports, wrestling is being offered. I don't know about if there's youth sports. I'm sorry, I don't know the answer to that.
And then think, how will you share information with the league, or how will the team know after the investigation over? I think you've answered that one.
Yep, exactly. So yeah, that's exactly. We'll communicate with the league or the coach, whoever, we need from you guys who's the best point of contact in all these settings, so we can let them know, okay, red team, they're back, they're good to go, they can get back on the field.
Okay, per Executive Order 72, all spectators for indoor and outdoor sports must wear face coverings at all times, or only if they cannot maintain 10 feet of physical distance.
I don't know the answer to that. Chris, I hate to put you on the spot again. Do you know the answer to that? I haven't looked at that one in depth. We can get back to you guys if Chris doesn't know it.
Okay. And if a person's been vaccinated and exposed later, do they need to be quarantined?
Nope. Yeah. So they're going to be, they do not need to be quarantined if it's within 3 months right now. Now they're saying 3 months right now because I wouldn't be surprised if soon they expanded it out to further time. But right now it's within, if you've been vaccinated within 3 months, like I said, I wouldn't be shocked if in a month we're hearing it. It's within 6 months now. They just need the data to be able to kind of pull this all together.
And if there's athletes playing both club teams and high school sports team, can exposure on one impact the other?
Yeah, of course. So if that infectious individual plays on both teams, then we are going to do contact investigations on both teams, right? So if you go to your high school team and you played, and then you played on your club team that night, yeah, it's an investigation on both teams. So we could have, more people quarantined based on this, however much exposures we had.
Okay. It's a specific question. If we are to pause a team during an investigation, how will the league know when the investigation is over so they can unpause the team?
Yeah, and I think Bob has the next question next. The health department contacts back to them to let them know. Whoever the designated point of contact is, we will let that individual know that the investigation is complete.
Then could you clarify the difference between direct and secondary exposure?
I don't know what that means.
Okay.
Yeah, I mean, our exposure with the slide that's actually showing is there's no kind of you're secondarily exposed. Yeah, no, it's either it's a yes or no question for us. You're exposed or you're not exposed.
Even for our low risk sports, investigators ask about whether kids' parents carpool to events, even if they're low risk. That's a question.
Yeah. So the low risk sports. So if you're talking about golf, of course, yeah. If there's a case amongst the golf team, we're gonna do an investigation. Now, the only difference in our guidance, if you remember from our table, is the competition. So I'm guessing we're assuming that there's not carpooling to with the competitor. But we'll that kind of falls inside of our investigation no matter what. We're asking about who are you with, in cars and all that kind of stuff. So of course that will be included.
The next one, another question about vaccines. If they've been exposed,
I think we answered already.
Quarantines. Yep.
Yes.
Given the impossibility of contact tracing an event, a clarification in sporting activities is important. Please answer directly. Will participants be assumed to be close contacts in the following outdoor sports: lacrosse, field hockey, baseball, softball, football?
So again, I don't know. So that's the thing. I don't know what is the practice activities that we have to talk to the coach, figure out how the team practices, how they scrimmage, if you guys are maintaining social distance during your entire practice, of course, guess what? No one is considered exposed. Now, competition, we need to obviously see, it's all based on the amount of competition. I will say, we try to do we absolutely try to only quarantine who we need to quarantine and we feel is appropriate for quarantine. But I can't put a blanket statement on there because I don't know the activities of that actual sport. Really, the practice activities are really what's going to govern it, right? Is it going to be, hey, well, they also all went to the weight room together, or they all do this, they jog together in the beginning of practice as a pack just to warm up. Well, that's a high risk activity and that might affect our investigation. So that's the type of things that we don't know until we start our investigation.
Okay. If a team member is deemed a close contact from a case, but not on the team, do any activities need to be paused?
No. I think this question is, so I am a close contact and I'm quarantined, but it's not because of an exposure on the team. It's because of an exposure at school or my parents. No activity, nothing would need to be paused there. They would be quarantined and you guys can keep playing the sport there.
Regarding the increase in cases that was mentioned, has there been corresponding increase to hospitalizations and deaths? Just to understand the context, it has been reported that youths don't get ill as much.
Yeah, no, it's a great point, Mark. Thankfully, right now, our health outcomes with our younger population are much better in regards to COVID-19. But you have to remember, so to answer your question, our hospitalizations and deaths have been, they've been trending downward, which is great. I think because I think we're seeing more young cases. So that's going to automatically say, hey, we have better health outcomes in regards to COVID-19. The problem is, though, we have to be so strong with our measures, because if we had a prolonged outbreak on a sports team and then that player went home and gave it to their severely immunocompromised, grandmother or parent, then that's really the transmission that we need to stop, right? We need to stop the community transmission that is going to be caused. So every time we have a case, we have multiple contacts, and multiple individuals can get sick with COVID-19. So it's an average of about, every person who gets COVID averages about one person that they give another person COVID to. So we want to stop that transmission so that we don't have more community spread getting to elderly or individuals who become more severely ill with COVID-19.
All right. Can you repeat the statement about a case order being for 10 days?
Yeah, so that's isolation. So individuals are isolated. The isolation order is 10 days. It's either from, so it's whatever is the longer period of time. The symptom onset, so when the person started developing symptoms, that would be one. If the person never develops any symptoms, though, it would be from the lab collection date. So that's the 10 days that we work with from there.
How do leagues provide contact information to the health department, and how do you designate a point of contact?
So the league themselves would decide that. So if you're a coach, I would talk to the league. I think all these I'm assuming all of these teams are formed within a league. You guys can say who your point of contact will be. You should have those discussions and say, hey, if we have a case on a team, the coach can report it, or I'm going to make sure I report it. So you guys should talk to yourselves about who you think is the most appropriate point of contact to make sure the messaging and all the information is given to the health department as quickly as possible. So that's a determination for you guys to decide. We just need you guys to get someone who understands that they're going to be the point of contact for an investigation. It might be the coach, or you might find it more appropriate at like the league level. It's up to you guys to decide that.
And then I think this one's for NCS. For youth wrestling, has it been approved to return to FCPS facilities?
Yeah, I'll answer that one. Jeff, you can reach out to me directly. We'll check with Bill Curran from FCPS. We don't schedule the wrestling room, but we'll reach out and get it answered for you.
Okay. For adult leagues, pausing, stopping of team activities would be required for all team members or only unvaccinated team members?
Unvaccinated team members. And so this is where it gets slightly tricky. You might need to pause because we might not know a lot of who's vaccinated and if they're fully vaccinated. I think that's going to be tricky, as we are absolutely going to probably have to adjust that as more adults are vaccinated. Right now, I would say with only about 20% of our adults vaccinated in Fairfax Health District, I would think you would still need to pause while we figure out who should be, who can come back and who doesn't need to be quarantined. That might change over the summer, though, as the number creeps higher and higher for vaccination. So stay tuned on that one.
Question, coaches are required to cooperate with health department requests, not just leagues? It looks like that's a question.
Yeah. So yeah, I mean, a lot of this is a lot of the issues that we run into is just confusion about, I don't know if I can give that information to you because, they've never dealt with that situation before. So it's anyone in the league needs to give us the information. We don't care who it is. We just need timely information from you guys in regards to the players on the team and the contact information. So if the coach is the best person to give that to us in a timely manner, it can be the coach. As I said before, and I have the slide up here, sports leagues, you can, I hate to put it this way, you may voluntarily comply with our investigation, or we'll get a court order to force you to do it, which makes it more untimely and can result in a misdemeanor. I mean, I think we all have the same goal here, right? Safe environment. So, I think I've laid out the groundwork of why we're doing this. You might disagree with it, but I mean, unfortunately for you, this is the reality of the situation we're in right now. We're in a pandemic. We need to take this as seriously as possible. We need to make sure we're doing thorough and timely case and contact investigations, because that is our responsibility as the health department. So yeah, I mean, it doesn't matter who, someone needs to work with us in a timely manner.
Okay, for spectators, are they required to wear masks at all times, or only if they can't maintain their social distance of 10+ feet?
I think Chris Yeah, spectators must wear masks over their nose and mouth. 10 feet of physical distance must be maintained between spectators who are not family members. So Chris found that out for us. So that's the answer.
Correct. And just to add, if any individual can't maintain 6 feet, they have to wear a mask. So, but for the spectators who are not family members, you got to keep that 10-foot distance.
Okay. This one's kind of long. If competition and fleeting contact means that you're a close contact, assuming that you're not a goalie, do you have an estimate of the number of children that will be asked to quarantine? Given the current level of COVID is still present in our community, it will likely be tens of thousands over the next 6 weeks.
So I don't think it would be that high. I mean, I think we have never said that fleeting contact would be a determination for exposure. You know, if you're talking about soccer here, soccer, we wouldn't just blanketly say everyone you competed against on the other team is exposed. Maybe one player on the other team, depending on the amount of physical interaction, or two players between a forward and a defenseman. We might deem that a close contact. For most players on the field, though, they're not going to be considered contacts to each other. Where you're going to see a lot of exposures and is just on the teams themselves, because they're practicing a whole lot more together. They're closer. Their, social mitigation is not being followed all the time during scrimmages. So you're going to see more exposures there. But the goal here is to stop the spread from one team to another as well. So we want to make sure that at least if we can keep it on one team, that's for the better. We're not trying to over quarantine our populations at all.
Okay. It has also been reported that kids don't necessarily serve as transmitters of the virus, which people have been asked in the league. So this is not the case, given your answer to the previous question.
Oh yeah, no, the kids absolutely have been. There's research is pretty clear that they absolutely can transmit the disease. Health outcomes amongst kids are much, much better. It falls more into common cold type. Obviously that's a little drastic, but that it's more of a common respiratory illness for children, but obviously with much more severe health outcomes for adults and a severely immunocompromised individuals.
And then
Jason, I just want to do a time check. We have about 3 or 4 more minutes. Okay.
Gotcha. Is reference to a league meaning the club or youth organization?
I don't know the terminology best there. NCS, you might know what I'm talking about there. I'm talking about the entity that's responsible for getting the groups together, the teams together, and competing.
Yeah, I would say that's the youth or adult organizations.
Yeah. All right. If 2 or more cases, why not test everyone immediately as done by pro and college sports team and isolate individuals rather than jumping to a 14-day quarantine for all team members and coaches?
So, James, it's a great question. So we are going to recommend, so part of our case and contact investigation is when we quarantine individuals, we recommend that they're tested 5 to 7 days after exposure. That is part of our quarantine practice. So those individuals should be being tested at the appropriate time interval from when they were exposed. So we do recommend testing for those individuals. Again, testing doesn't prove you don't have COVID. It takes 14 days. So we're going to always stick with our 14-day quarantine period.
All right. Sorry. Has there been any discussion having youth participants not wearing masks while playing, or is this going to be vaccine dependent?
I'm not an expert on, I think certain sports it's recommended, certain sports it's not, because it's a safety issue. I am not an expert on which sports are which. I will say that the mask recommendation will stay for the sports it's recommended for right now until we're starting to vaccinate these populations.
All right, I think this is going to be the last one. Do you know if the health department would consider working with sports leagues for vaccine fairs for families and those over 16? It's a good question. I don't know the answer to it. I think we are always looking for ways to expand our vaccine capacity at the health department. I think it's great that we have you guys in a kind of a communication loop to be able to share information with you. So at the very least, we will utilize you guys to share how to sign up for vaccine information. And you can share it with your teams and things like that. Right now, to be honest, it's pretty straightforward. Once it opens up to the general population,
you're just going to go to our health department website and try to find a vaccine dose. I mean, that's kind of how the process is going to be. In regards to fairs and community clinics, we absolutely will try to share that information with you all. And then I'll look into further, you know, kind of the utility of bringing you all on board in kind of a more enhanced role in regards to vaccination.
And just to put a finer point on Sean's answer, important to keep in mind that some vaccines are approved for 16 and up, others are approved for 18 and up.
Yeah.
I think all of the manufacturers are doing, or at least attempting to do some studies on younger youth to see if it can be safe and brought in under the emergency use authorization. So we're waiting on that data, but for now it's either 16 or 18 and above, depending on the vaccine.
Mm-hmm. I did want to mention one thing before we jump off. It could be a kind of a final point to you all. A few of your colleagues have given us some comments on the documentation to clarify some verbiage. We are hoping to clarify that verbiage to try to minimize confusion. Again, the document that we provided you all, we want you to share that with parents, with coaches, you know, amongst your league. Again, that's the purpose of that document. We're also going to put out some of the guidance to you all, just for you all itself, about, and of course you're willing to share, about kind of the legal requirements of reporting. We're hoping to get that out to you again this week as well, so that you guys have that in writing and you can share it with any parents who are concerned. But those two things we're trying to get to you guys as soon as possible. So again, thank you so much for everything. I think, I hope this was beneficial to you all. I see the comments are coming in. Thank yous. I do really appreciate you guys coming on so late and working with us on this. Obviously, we feel it is very important. And the ultimate goal here, obviously, is to get youth sports back to what it was 2 years ago. And without your guys' partnership, it won't be there. So thank you so much.
Thank you, everyone.
Thank you, Sean, Chris. And that will conclude our presentation. I want to thank everyone again, and remind everyone that this presentation will be on our Athletic Services website for your use if you want to send it out to your organization members or whatever, and we'll also send it out to you as well. All right. Thanks, everyone.
Thanks all, everyone.
Thank you very much.